Today we're going to discuss what are the treatment options for patients with kidney failure. For those who tune for the first time, I'm Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Kidney Medical Center in Singapore. This is the bite-sized information for kidney and related diseases. The aim of this video blog is destined to help patients with kidney problems or at risk of kidney problems or their relatives to understand the disease better, so they can have better discussions with their doctor or with me if they choose me, so they can manage their disease better. And as a consequence, they can experience less complications and less worries as well. So today we're going to discuss what are the treatment options for patients with kidney failure when the kidneys totally fail. Patients being diagnosed with total kidney failure have 5 main broad treatment options: kidney transplantation, hemodialysis, peritoneal dialysis, entering a disease retardation program, and palliative care. Overall, kidney transplantation is the best treatment to replace the kidney function, but not every patient is suitable medically for this. Might not be suitable for the patient because of medical conditions, might not have a suitable donor, a healthy donor, or a willing donor, or they might have other reasons for not to consider transplantation. In occasions, is due to some misconceptions of kidney transplantation, or for not having been given the right information or sufficient information regarding the rationale, the pros and cons of kidney transplantation over other renal replacement therapies like dialysis. So they cannot take the best informed decision. Then, after transplantation, hemodialysis or peritoneal dialysis are the second best options. Hemodialysis and peritoneal dialysis are overall equally effective to clean the blood, but they are not as good as a kidney transplant and not as good as the original kidneys. However, they might not be also suitable for some patients, or maybe one therapy is not suitable for some and the other yes, and vice versa, depending on their own medical conditions and their overall strength or frailty. For different people, hemodialysis and peritoneal dialysis provide different advantages, but also come with distinct inconveniences. So the decision and choice must be individualized. And an important consideration is to choose the therapy more permissive of their own lifestyles and which tally or matches better their priorities in life and their personality. Irrespective of the kidney function deteriorating and the preparation for dialysis or the initiation of dialysis being quite imminent, some patients opt not to have dialysis at all or a kidney transplant. In occasions, this is out of fear, which is natural due to the gravity of the diagnosis. Kidney failure is a heavy diagnosis, but maybe they just need a little more of support and explanation and coaching. But in occasions, it is a firm and respectable decision taken by the patients that they don't want to do anything of them. Maybe because they are too weak already, too debilitated to start dialysis, or to undergo a major surgery like kidney transplantation. Then all the efforts from the doctor, the patient, the family are to try to prolong the life of the kidneys for as long as possible. And these efforts include modifications of risk factors, some therapies for renal protection, and the implementation of what I call a more frugal lifestyle. This one, it is very important. In my years of experience, most of my patients that come into good term with their disease and live a more frugal and healthier lifestyle tend to protect their kidneys better and do better and even live longer than patients that don't do it, even after developing total kidney failure and starting dialysis. Finally, for some patients who are very ill or extremely weak and too frail because of their underlying condition, comorbidities, or because the kidney failure is too advanced, or they are very elderly and weak, dialysis might be too taxing already and risky for them. Because dialysis is a very strong therapy, then dialysis is not an option for them anymore. Likewise, they will not be able to take a major surgery like a kidney transplant, with the risk that not even surviving the surgery. So that's why also transplantation is not an option for everyone. It's the best option in the average patient. But that's why you need to see specialists to try to tailor all the generalities to your particular situation and condition. Therefore, in these cases that they cannot do transplant or undergo dialysis and the disease is very advanced already, the kidney failure, the focus of medical care is to continue with medications and to ensure that the patient is comfortable as much as possible, especially at the end of life. And this is called palliative care. Palliative care doctors aim to make the last days of the patients as bearable and comfortable as possible, not only for them but also for their families. And this can be overwhelming for the patient but also for their loved ones, both physically and emotionally, because they're seeing their loved one, their vitality, going away. In Francisco Kidney Medical Center, we understand how difficult the decision of choosing a therapy can be. We cannot decide for our patients, but we provide detailed information on the rationale, pros and cons of each type of therapy, their overall comparison, but also, although we allow the patient to work with the relatives to choose the best therapy, we do weigh the options for them using my medical knowledge and experience according to their condition, so they can have the best elements to take the best possible decision, because it is difficult to decide going for this type of dialysis, for the other, or a transplant, or when to start, when to plan, etc. And we always take into account their condition, their life priorities, and their personality. So in Francisco Kidney and Medical Center, we provide empathetic, approachable, and flexible specialist renal and medical care, because we can imagine the struggles our patients and their relatives could face, and because we care about the physical and mental well-being of our patients and their families, because as I have mentioned many times, the disease not only suffered by the patients, but by everyone. But also, we aim to try to that our patients take good care of their disease, their health, they do what is necessary, but then the rest of the time try to enjoy life as normal as possible. be overwhelmed by the fact that they have a disease, even that the disease is severe. It is easy for me to say, but I have seen it in my patients. The patients that still keep a more positive, proactive mindset, they also tend to do better. So if you need my help, also you can contact me. I wonder if there's any question or any comment. Try not to be so quiet. Try not to make this a monologue, please. The more you ask, the more you can learn, the more other people can learn and benefit. So it doesn't matter you're not doing now, but you can do it later in the replay. What is ideal? This is not because I'm saying, but you know, being here is not common. No, like they have a specialist, is giving you a lot of advice in different topics. We have discussed already. This is the 22nd, and there are still many to come. So utilize me, use me now that you can. So make use of that, please. If no comments, I am Dr. Francisco wishing you the best possible health. Take care. Bye bye.